This is the picture that was shared of Whittaker's jaw, and I've edited a little bit to try and remove some of the graphicness, but what you're looking at is his lower row of teeth, and these three teeth in the front are displaced into his mouth because his jaw is fractured. So that's not just that the teeth fell out. The teeth are actually still attached to that lower portion where they're anchored into the jaw, but the jaw is broken in a way that's caused his teeth to completely displace backwards into his mouth. If we look at our biodigital anatomy tool here, we can highlight and see what exactly we're talking about with that anatomy. So this lower bone right here, that's going to be the mandible. This portion is going to be the temporomandibular joint located right up there. You can feel that move. When somebody dislocates their jaw, it's going to be that joint up here that gets dislocated. But then you can see how the teeth are anchored into that underlying bone. And so in Whittaker's case, basically these three front teeth anchored into the lower portion of the jaw got crushed from that forearm that Khamzat Chimaev applied, causing a fracture, causing that bit of the jaw and the teeth to displace backwards up into his mouth. Treatment of this is going to be some type of surgery to put those teeth, that bone back in place, plate, potentially braces across the teeth. Real possibility here that Whittaker might end up having his jaw wired shut for some time. So this is a serious injury. There's also some nerves that travel along these areas. This little hole right here, there's some nerves that come out that help supply innervation to your teeth. When you go to the dentist, you have your teeth numb. Those are the nerves that they're targeting. So looking back at that picture now, envisioning that anatomy model where all these teeth are anchored into that lower jaw, the mandible, and seeing these three displaced back, again, mandible fracture, not a jaw dislocation. If this was a choke submission, he would have had the arm underneath his jaw, but instead you can see it slip up right there. That left arm anchors in front, the lower portion of the jaw loading on the teeth, and then just pushing backwards, trying to apply that choke, just crushes Whittaker's jaw.